Now, if you're considering to take nursing as a course, please watch this video, and as I show you how it is one of the toughest course to pursue. So either way, if you want to pursue it at degree levels, the minimum grade required is at least a B, or even some universities are very strict. They'll be on B plus and nothing less. And obviously the language, the requirements in other subjects, like let's say the biology, the chemistry, so that's in, and that's just it. And then for those who decide to do a diploma, there are always various schools to choose from. So there are various medical schools that you can always do, and even some universities will offer the option of a diploma, yes, so that you can easily upgrade. So the advice would be, if your plan is to eventually upgrade, like do the diploma, then do the degree, you'd rather go to an institution that offers both, so that it's easier to upgrade, because you just upgrade with them. You do your diploma, and then diploma is usually a requirement sometimes for those who want to upgrade to do it. For those who decide to go the KMTC method, KMTC is a very reputable institution, because most of the time when you go to most universities, they'll just take your KMTC certificate and then use it. But then also there's the higher diploma option. So then you go to KMTC, you do the diploma, then you upgrade to the higher diploma. If you come with a certificate from another school, integration is possible, but some of the time it's very difficult. So that is the advice. Do it. If you plan to upgrade, do it from an institution that offers both. Another thing, are you ready for the long working hours? Because nursing school is very difficult. There's a lot of reading that goes into it. They usually spend weeks in the hospital just analyzing cases. So you have to be prepared to also just have your time, and to also get into the field eventually and do the long hours, the night shifts. Because mind you, we are in a third world country, and most labor laws are not as followed as they should be. The sad reality, but that is the reality. So you have to be prepared for all that. So just make sure that you are ready to put in the hours in school and even outside, and then be ready to wear the uniform, because as a nurse you need to always be in uniform. Most of them are just the blue tunic, and those it's supposed to create a calm mood for the patient, and that's just it. And then also the scarcity of jobs, a dilemma that is happening, but it's very common in third world countries, is that most people are struggling to get jobs. But the good thing about nursing is that opportunities abroad are also a lot. That's why you see many people who are doing nursing, they go to do the NCLEX exams, and then they go to other schools like Canada and Europe just to pursue their better greener pastures. So it's easier to get to just upgrade and get greener pastures while you started with nursing. So the sad reality is that sometimes you might have so much hope for it, but it works. So these are just the challenges even after graduation. So before graduation is the long working hours, the school fees, because it takes 4 years in campus and then 3.5 years in KMTC. Yes, it's the longest course in KMTC. It takes 3.5 years. And that's just it. So you do that course, you finish everything, and then now you get to advance and do the higher diploma. And for those who want to do the to go and advance, and that's always an option, so you can always follow that. Make sure you have your eye out for opportunity, but nursing is a good course and you can done really well.